Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course.
Brad, what are you reading?
Well, I got this nice book by James Syriacs, as we've talked in the past, and looking at biceps tendon, the long head, and how to work some techniques on how to cure. You got some
Exactly.
information
That's
on
what
that?
we're going to discuss here today, is how to effectively self-treat shoulder tendonitis. And this is just a technique you can try. It's very simple. Well, I shouldn't say it's very simple, but it is something I think you can try. And James Syriacs, by the way, he was the father, considered the father of orthopedic medicine. Very well respected. He's been dead for 20 years, but his influence continues on.
Oh, yeah.
He's come up with many techniques that have since been used by hundreds of thousands of therapists.
Sure.
And it's really changed our profession. So the tendonitis we're talking about today is basically when you're starting to have pain on the front of the shoulder. You can have tendonitis back here too, but we're not talking about that today. We're going to talk about two different tendinitises, both of them that can occur on the front of the shoulder. Generally, a lot of times what you're going to feel is, you're going to feel pain either when you bend your arm like this, okay, and you're using the bicep, and that would be the bicep tendonitis, or if you're lifting the arm like this and you're starting to have pain. Often the characteristic of, and this is supraspinatus tendonitis, you don't need to know that, but the characteristic of this type, which is the kind I had, is you go halfway up and there's pain, and then you go a little further and there's no pain.
Yeah.
It's what we call a painful arc. So you go pain, 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 no pain. Okay? There's also the kind where you have pain just way up at the top.
Sure.
And that's also a different type of supraspinatus tendonitis, but that's a hard one to treat. So what are we doing? What we're going to use today is cross-fiber friction massage. Now that's a mouthful, but what that means is it's a really localized massage, Brad. It's not a general massage.
Sure.
Right. We're getting a real small area, and by doing so, we can actually change the fibers of the tendon.
So should we just go through, we're talking about the biceps is two muscles, and there is one tendon in the biceps called the long head.
The long head,
and the short head, and we're looking at the long head.
We're looking at the long head. Let's first talk about what a tendon is.
Sure.
This is all it's important to understand this, Brad, in order to be able to do this treatment. You got the muscle, okay, this would be your muscle, Brad. Wow, look at that. And the muscle narrows up and becomes a tendon. So this is the tendon part here, this is the tendon part here. This is where you often get the injury. Now, it can be from a single event, but more often than not, it's going to be from repetitive injury.
Yeah.
So you're using the muscle over and over again, or you're lifting over and over again, and that's how you start to actually get some damage done to that tendon. Probably some micro tears, and those micro tears start to heal, and you get an inflammatory process, and that's the tendonitis. It actually inflames and gets flared up.
I often explain to patients it's kind of like a rope that starts to fray a little bit. It's still there, it's still functional, but it's fraying and it's getting weaker.
That's a very good way of describing it.
And then the inflammation starts, and that process continues to be uncomfortable and painful.
So what we're going to do is we're going to actually rub. Can we have the model, by the way? Oh, she was ready for us.
Oh,
So this is a shoulder.
doesn't look like a shoulder.
Doesn't look like a shoulder, Brad. You want to face this way
Yeah.
so we can. It's actually this shoulder right here. It's on the right side. And what we're going to do here is I'm actually going to take the bone out here.
So that's the humerus bone.
This is this long bone right here.
All this, by the way, is the scapula, or the shoulder blade, and then the collarbone there to get reference. And
so we got the bone right here, and the muscle, the bicep muscle, is actually cut off here, but you can actually see the tendon here. You got that, Nancy? So here's the tendon, and this is the part that gets all frayed and inflamed. So what we're going to do is we're actually going to rub across that tendon with our fingers. All right, and what that does is it actually starts getting more blood flow to that area, and it helps it heal quicker. But the other thing it does, when muscle or tendon starts to heal, it heals in what you use the word cobweb fashion. Right?
yeah, like spider webs, if they all get all tangled up, then it's a big
So
mess.
it's in every which way like this, and it starts to adhere to the bone or bind down to the bone.
Yeah, the scar tissue is
So it doesn't run smooth anymore, and that gives you pain. So what we want to do is rub across that and help realign that so that the fibers become more like this, and you break up that scar tissue. And it's really can be amazing the effect this can have. I have to be a personal advocate of this. I just had some of the shoulder pain. I did it and it just went away immediately. I just really had great results with it. So any other discussion about the cross fiber before we show the technique, Brad?
No, I think that, you know, we're looking at the fibers and the tendon going up and down this direction. In your arm, you know, the tendon's way up here, it's kind of deep. It's underneath your deltoid muscles.
Right.
So you got to get through those muscles to get to that
So
tendon.
we're going to have to rub hard, and we'll go over that. But again, we're going to cross the tendon, across this way, not up and down.
This way.
Okay, this is specifically for what we think is bicep tendonitis, and again, that would be as if you're having increased pain in the arm when you're moving the arm, like when you move the elbow up like this, or
Right.
if you're turning your arm like this and you're feeling it up in your shoulder, that would be probably more bicep tendonitis. So what you want to do is you want to sit yourself in a chair, probably put a pillow or something underneath the arm to support it. And I want the arm just relaxed, the muscle needs to be relaxed while you're doing this, and maybe even turn this way a little bit. It's just relaxing, palm up, the shoulders even more. And because you do not know anatomy, you're just going to have to kind of rub around until you find the spot. And you're going to have to use your, obviously, other arm, Brad. But what you're going to do is you can do 2 fingers like this. You can do 1 finger over the top of another finger, either one, okay? And
Can you play rock, scissors?
rock, paper.
Yeah, I usually do. I kind of put all these together so I can get more
both
support.
even, a little bit of both.
Yeah, it's kind of a.
And you're not just moving skin here. You're getting deep down, very deep.
Right.
If you're just moving skin like here, you're going to actually could cause a blister on the skin, or if you're going friction like this.
Yeah.
The skin and your finger are moving together, and you're finding the spot that's tender. Now on you, I mean, I can find, that's probably the groove right there. Or do you think I'm too far over?
It's hard for me to say. There,
I think that's it right there. All right, so I'm going to go across a good 2 centimeters, which is almost an inch, right, Brad?
Yeah, 2.5-ish.
Okay, going across like this. I'm moving the skin, and you want to kind of move your whole arm like this, not just your finger like this, because your fingers are going to get sore otherwise. So you're moving your whole arm. I'm really pinpointing, getting in that spot.
Is that going to hurt, Bob?
It may hurt a little bit. Now the idea here is that if it hurts and it just keeps hurting, it even gets worse, you need to back off, maybe ice it a few days, because it's just too tender to do it.
Right.
But if you're able to do it and it starts to calm down or get numb, that's a really good sign. That means you're on the right path.
And how long will that usually take before you...
Usually a minute or 2, I'd say, before you're going to start seeing it turn numb. Wouldn't you agree?
Yeah, I think I usually tell people if within 30 seconds, if it's starting to hurt worse, for sure stop.
Yeah, if it's getting worse.
Usually after 30 seconds, I usually say you should start feeling that positive response, and then you keep going at it for that minute to 2 minutes.
And, you know, you can actually do this even much longer. I mean, Syriac says you can do it up to 15 minutes. I've never done it even close to that. I've maybe done for 5 minutes at the most, and that's usually on some of the subsequent ones. Bicep, it usually is very responsive to this because it's an area you can get to very easily, and you can do it every other day actually for a couple weeks. Mine didn't last that long. I didn't need to do it that often for it to get better.
So you're saying after a minute or 2 it's going to start to feel better, feel numbish?
It should actually feel numb.
And that's a good thing.
And that's a good thing. If it starts to hurt more and more and more and more, it's too much for right now and you need to stop. All right, the other one is the one where, again, you have when you raise the shoulder, it actually hurts, and it might be a painful arc, like you go up halfway and it hurts, and then the pain actually goes away. That's the kind I had. It's actually pinching in there is what's going on. Or if you get all the way up to the top and it hurts at the end, that's more often the supraspinatus muscle. Again, you don't need to know where that is or how that works, but the best way to get at that, and Brad and I were just talking, and this is maybe trouble for some people to even get back the way, but if you put your arm actually way back like that behind your shoulder, or behind your back.
This might, if it's flared up enough, you won't be able to get your arm back.
You may not, but, and then you're going to have to just find the tender spot. It's very difficult if you're not a therapist to know exactly where to go. I would just kind of go around until you find a good tender spot. It may not be the exact spot. Syriac says the tender spot is not necessarily the spot to rub, but again, you don't have a therapist with you. What does it harm to try this?
Right.
So, usually find the big bump there and go right behind it is what you want to do. So that'd be right here, Brad.
And again, it's the same rules.
Same
It should
rules.
start, if it starts to hurt more and more, you're, put something, get rid of it, you know, stop rubbing it and get some ice on it.
Yeah. If you can't put your arm behind you, I would go ahead and try it this way.
Yeah.
I would still put it like this. This is what I did, to be honest with you. And I just went in there and I kind of found the groove there and I went right there. And that's the one that took care of my problem. And again, I'm going about 2 centimeters across. I'm rubbing pretty darn hard. I'm down in there.
Yeah, he's getting in there.
Don't be deceived by the, you know, I mean, I'm really pushing quite hard. Again, this can be a really cool way of having the tendonitis calm down. The other thing is, you know, while you're treating this arm and while you're trying to get it to calm down, avoid overhead activities.
Right.
Try not to sleep with your arm overhead. I even at night was putting my arms up on a pillow and stuff like that to let it calm down, and so it seemed like that helped too.
Yeah.
If it isn't, when you start rubbing it, it's just too tender. You should try icing it for a while. We've got videos on how to ice it and try that. So, anything else, Brad?
No, I think that covers the old cross friction in the shoulder pretty good.
Because we can fix just about anything, Brad, can't we?
Well, yeah, except for a broken heart, Bob. We're still not good at that yet.
We'll have to figure that one out.
Sooner or later.